Hello everyone, and welcome to the Total Joint Education class of Self-Regional Healthcare. Thank you for choosing the South Carolina Joint Center at Self-Regional Healthcare for your joint replacement needs. We provide quality results and great outcomes. Self-Regional has gained national recognition for our joint replacement services. We are a Blue Cross Center of Distinction which recognizes facilities for their quality outcomes in joint replacement. This is Michelle Kelly. She is the Joint Care Coordinator for the South Carolina Joint Center. She has been an employee with Self-Regional for over 30 years. Her experience is orthopedics and surgical care. Her role is to navigate you through the pre, post-op, and recovery phases of your joint surgery. Michelle will enhance your recovery by providing today's education, making rounds while you are in the hospital, addressing any concerns that you may have during your course of treatment and recovery period, and if needed, Michelle's number is listed in the front of your guidebook. We want you to understand how to prepare yourself for surgery, inform you of what to expect during your stay, review physical and occupational therapy, pain management, the role of your coach, discharge home after surgery. Exercise is the best way to prepare yourself for surgery. You are encouraged to exercise until the day before surgery. We will refer you to our Transitional Rehab program. If you have not started this program, it is not too late. Even beginning the week before surgery will be an advantage to you and your recovery. This program allows you to participate in group therapy, which prepares you for the best outcome. If you have questions regarding this program, please contact our office at 864-229-2663 and ask for Nancy. Your diet is also very important. Be sure to drink plenty of fluids to stay hydrated. Hydration is very important in surgery and recovery. Fiber is also important to your diet. You can boost your fiber by eating foods like almonds, broccoli, beans, and corn. Also eat foods high in vitamin C and rich in iron such as oranges, tomatoes, cheese, yogurt, and dark leafy greens. Smoking increases the risk of infection and slows your recovery process. Your surgeon will discuss smoking with you, and your surgery may be delayed if you are not willing to quit prior to surgery. If you have not already been provided an appointment, you will be scheduled for our pre-operative Ready for Surgery clinic. They will review your medical history, medications, order any tests needed prior to surgery, and provide you with pre-operative instructions. This clinic is designed to ensure all patients are safe for surgery. You have been provided a guidebook based on the type of procedure you will have. This guidebook contains information on caring for yourself at home. It helps to plan ahead for things such as decluttering your home, arranging for care of your pets, etc. We also have asked that you select a person with whom you are close to serve as your coach and support during your recovery period. We want to prepare them as well on what to expect during your recovery period and how best to assist you. Again, Michelle's contact information is in the front of the guidebook. Please contact her with any questions. Her office hours are Monday through Friday, 8 a.m. to 4:30 p.m. Resuming activity will depend on you. The pre-rehabilitation class is an excellent investment for your upcoming procedure and recovery. Patients who attend these classes have less pain and a shorter recovery period. It is a great investment to prepare for the best outcome. No special chair is needed, but you need a chair which offers support and comfort. It needs to have sturdy side arms to support you getting in and out of the chair. No special bed, such as a hospital bed, is needed. Change your bed linens prior to surgery to reduce risk of infection. Declutter your home. Temporarily put away area rugs that may be a tripping hazard. Place night lights in bedrooms, hallways, and bathrooms to provide light access at night. You will discharge home with a walker. To better prepare your home, walk around your home with a walker or pretend walker to ensure you have space to accommodate prior to surgery. Move things needed to ensure you have a clear pathway to walk with a walker at home. Shop ahead. Have food available to put into the microwave and paper plates to limit washing. Pets can be a fall hazard and carry bacteria. Do not let your pet get close to your incision until the sutures or bandage has been removed and your incision is fully healed. The day before surgery, you will need to contact us to obtain your arrival time for the day of surgery. Call after 2 p.m. If surgery is on Monday, call Friday after 2 p.m. 864-725-4001. Do not eat or drink anything after midnight the night before surgery. Use chlorhexidine soap 5 days prior to surgery, the night before and morning of surgery. This will be provided to you at the Ready for Surgery clinic along with specific directions. You will also be given a prescription for Bactroban nasal ointment. You will apply this in each nostril twice a day for 5 days prior to surgery. Please bring loose-fitting clothes with you to the hospital. You can bring walking shoes or use the non-skid socks provided by the hospital. You can bring your guidebook or something to read. Local cable is provided in each private room. If you are having a total knee replacement, you need to wear white cotton underwear. Please leave all valuables, cash, and medications at home. If you are not a same-day discharge, your surgeon requests that you are dressed in your clothes the evening after surgery. They like to see you sitting in the chair having dinner that evening. You will be asked to arrive at the hospital main entrance, A, or surgery center entrance, B, at least 1.5 hours prior to your surgery. This gives your clinical team time to prep you for surgery. One family member or friend may wait in the surgery waiting room and updates will be provided by the OR during your surgery. If you are not discharging the same day, you will stay overnight. Please have family and friends check on visitation hours as they may have changed. Once you arrive for surgery and get registered and transported to the ambulatory surgery department, they will ask medical history, go over your medications, measure you for compression hose, start your IV, and provide you a hospital gown. Once this is complete, you will be provided pre-surgical medications. It may seem we review your medications and history quite a number of times with you. This is for safety during the surgical process and hospital stay. Your anesthesiologist or nurse anesthetist will meet you the day of your surgery in the preoperative holding area. They will discuss the different types of anesthesia that are available to you with a recommendation of the type of anesthesia you will receive. You will also need to sign a consent form for anesthesia. After surgery, you will be taken to the Pacu recovery room. Here you will be monitored closely by specially trained nurses for 1 to 2 hours. During this period, the nurses will monitor your oxygen level, breathing, and heart functions. You may require supplemental oxygen during this period. Your pain level will be assessed and medication will be provided to help with relief. You will be transferred to the orthopedic tower or ambulatory surgery center as soon as you are stable and awake easily. We use a number rating scale of 0 to 10 on most adult patients. The smiley faces may help with the visual effect of the intensity of pain you are experiencing. 0 is no pain being experienced whatsoever. Pain levels up to 4 are usually tolerable, may need mild form of medication or relief. Pain levels greater than 4 begin moderate pain and begins to disturb sleep, mobility, and conversation. You will probably need a stronger medication, usually still orally, in order just to move about and be fairly comfortable once the medicine takes effect. Pain levels reaching 7 through 10 become severe. By the time your pain reaches this level, it is more difficult to get under control. You may not be able to function with tasks we may need for you to do. It is very important to get your pain under control before it reaches this level. Do not let your pain level get out of control. The doctor has ordered medication for you. Provide your nurse an accurate assessment of your pain because it is what you are experiencing, so that they can medicate you appropriately. Your nurse will write on the board in your room when your pain medication is due. It will be up to you to request additional medication after your initial dose. Cryo-Cuff Ice Machines are used for both hip and knee replacements. This is plugged into the wall to keep the water cold and circulating. You will take the device home with you. You will need to fill with ice or use small frozen water bottles and add water to provide comfort. This is an excellent tool to use after therapy or after you have moved around a bit. In the beginning, the more you move, the more sore you may be. This machine will decrease swelling, which should help decrease your pain. Positioning. We want you to be mobile as soon as possible. This helps prevent any post-op complications. You may see another physician while in the hospital. If you have medical conditions that need to be managed while in the hospital, you will also see a hospitalist during your stay. Our hospitalists are here to ensure you have what is needed to manage other medical conditions while you are in the hospital. Activities that you will be doing the day of surgery. turning from side to back, helps to keep you moving. Physical therapy will evaluate you the day of surgery. If you are going home same day, physical therapy will work with you on steps, walking with a walker, and preparing you for your home. Ankle pumps. While resting, pump your feet back and forth. This is very important for circulation and to help in prevention of blood clots. If you are discharged home the day of surgery, you will be provided instructions of what to complete at home before your physical therapy appointment the next day. If you are not discharged the day of surgery and stay overnight, your schedule will be similar to this. You will have physical therapy twice. Early morning session starts around 8:30 a.m. and again after lunch, followed by occupational therapy. We will discontinue IV fluids, and thrombic pumps will stay on while you are in bed. Continue to use your incentive spirometer. Your surgical dressing may be changed. You will take a shower, and after your second therapy session, you will be discharged home. Physical therapy will begin the day of surgery. With both hip and knee patients, therapy will focus on bed, mobility, transfers, walking, and strengthening. The therapist will have you attempt stairs to make sure you are comfortable going up and down steps if you have them at home. Therapy will also address if there is a need for any other equipment with the case manager to ensure you are discharged with the appropriate equipment. There are 3 precautions that patients must follow after a hip replacement surgery. You will need to follow these precautions until the doctor tells you otherwise. No twisting or pivoting on the leg you had surgery on. You always want your toes pointing in the same direction as your nose over toes. No low chairs or bending to your hip to flex beyond 90 degrees. No crossing of the legs. For total knee replacements, do not put a pillow under your knee. This may be comfortable, but it is not a good position for your knee. It can cause your knee to become stiff and limit your ability to straighten your knee completely. This will delay your recovery. Your knee needs to remain straight while resting, so do not place a pillow under your knee. Occupational therapy will evaluate you the first day after your surgery. They will assess your strength and activities of daily living, like dressing and bathing. They will also show you how to use the different types of adaptive equipment that will make these activities easier, especially for hip patients who need to maintain their precautions. Hip patients will receive a hip kit, which contains a sock aid, reacher, and a long-handled shoehorn. Most patients after a total hip replacement will come from surgery with a knee immobilizer placed. You need to wear the knee immobilizer at night until the doctor tells you otherwise. This will help you to maintain your hip precautions at night while you are asleep. Possible equipment that you will need are a rolling walker and a bedside toilet stand. As you continue with your therapy after discharge, your therapist will work with transitioning you to a cane if needed. Having a bedside toilet is helpful. It should be placed over your existing toilet to give you a higher seat. It will also have the armrests so that you can push up from them to get to standing in a safe manner. Ensure you have arranged for transportation to go home. Most will go home on post-op day 1 and some the same day as surgery. You will be discharged when your medical condition is stable, you are able to eat, urinate, your pain is controlled, and you successfully meet therapy goals. Please ensure before surgery your home is safe for you to return. I'm sure by now you realize you will return home. This is an elective surgery, and the planning before surgery is essential to ensure your return home safely. It's not too early to begin meal planning and arrange for family and friends to check on you once you return home or stay with you for a few days. Once you are discharged, you will be scheduled for either outpatient therapy or home health therapy. Most knee patients transition immediately to outpatient therapy. Hip patients will go home with home health initially for about a week and then transition to outpatient therapy. If you are discharged with home health, Self Regional provides home health in our 7 counties: Abbeville, Greenwood, Edgefield, Lawrence, McCormick, Newberry, and Saluda. Your coach will play a very important role in your recovery. This is where you will put into practice what you have learned for a supportive role. It is important to us that you feel comfortable with assisting in care prior to discharge. Please feel free to ask the nurse or Michelle any questions about how to assist in care. Signs of when to call the doctor: swelling that does not go away, fever or redness, dressing comes off. Our office has an after-hours nurse triage service. If you have any questions or concerns related to your surgery, please contact us. Most questions can be answered through our triage nurse, which may prevent a trip to the emergency room unless it is needed. Do not contact our nurse if you are having chest pain or signs of a stroke. Chest pain or stroke symptoms are not related to your surgery. In this case, call 911 immediately. We want you to be aware of post-operative complications and what to expect in your post-op course to aid in this prevention. Your participation is the key to decrease post-op complications. Blood clots. To prevent blood clots from forming in the veins of the legs, anthrombic foot wraps will be applied during the pre-op phase. You will wear these while you are in bed. Early walking is a primary key in the prevention of blood clots. Pneumonia. Although rare, pneumonia is a possible post-op complication because you have received anesthesia. You are moving about less than usual, and you are guarded with your breathing and coughing because it is painful. You will be shown by our team how to use an incentive spirometer. You will need to do this at least 10 times every 2 hours while awake, even at home. The staff will have you turning, coughing, and deep breathing in order to keep your lungs expanded and prevent pneumonia. You may experience nausea and vomiting. If you have these symptoms, please notify your nurse and you will be provided medication to help with this. Positioning. Change your position every 45 minutes throughout the day. Use of ice. Use ice for pain management. This will help decrease discomfort. Do not apply ice directly to your skin. Place pad on top of a pillowcase for best relief. Do not place directly on skin. Towels may be too thick to feel the benefits. Breathing. Continue to use your incentive spirometer when you go home. Diet. If you are prescribed Coumadin, you will be given a diet to follow. See Guidebook. Sleeping. Sleep on a firm mattress for knees. Do not put a pillow under your knee. Hip patients always turn with 2 pillows between your legs. Walking. Refer to your guidebook for length of walking. Take your medication as prescribed, usually every 4 to 6 hours as needed. You may find relief in extra-strength Tylenol. You may take 2 Tylenol extra strength up to 4 times a day. Plan to take at least 30 minutes prior to activities to control incisional pain. It is recommended to use stool softeners during the recovery process, especially if you are still taking narcotic pain medications, as these can contribute to constipation. Your surgeon will recommend what is best to take. Your surgeon will determine when it is best for you to resume your pre-operative medications. This includes patients who take warfarin or Coumadin or Eliquis. You may be requested to avoid Advil, Motrin, or other ibuprofen medications until your surgeon says it is safe to resume. For medication refills, make these through the surgeon's office Monday through Friday only. Refills are not completed over the weekend or after 12 p.m. on Fridays. Call the office for refills at least 1 to 2 days in advance. Refills will be sent directly to your pharmacy, so have the name of the pharmacy and telephone number and your date of birth ready when you call. Pearls of recovery. Keep the same day each calendar week. Small progress is still progress. Keep at it. Recovery will be slow at first, and please follow your surgeon's recommendations to maximize your outcomes. Our aim is to return you to a full activity level, so protect your investment by following the suggestions on good body mechanics listed in your guidebook. Thank you for your participation today, and we look forward to seeing you soon.